Welcome to another edition of the Diabetes Remission Roadmap podcast. And Brian, I got a question for you. Are your
Yeah.
numbers lying to you when it comes to your blood sugar? Like they
I
were
mean, I
lying
don't
to you about
check
the
my
Cincinnati
numbers.
Reds?
Yeah, I'm not wearing a Reds hat.
It's okay.
My
So, welcome back, folks. For those of you who are watching on our YouTube channel, I'm wearing a Chicago Cubs hat because as we record this, the Cubs have just swept the Cincinnati Reds, who just happen to be Brian's favorite team. And as we all know, putting our happiness into a thing that we have zero control over is such a good idea. Just kidding.
yeah,
However, my kids have been very happy with the way the Cubs have beaten the Reds around. And there's actually a lesson underneath the hood here about numbers because, and I'm going to make this work, Brian. You hang in there because going into the series on Monday, the Cincinnati Reds were in first place in the National League Central Division. And Brian was like, the National League, the first place Reds, this is great. And I like to look at some other different numbers. There's a record, and that's the outcome. And underneath the hood, though, the Reds' run differential was negative, which means the teams are scoring more runs than the Reds were. And they had this thing called the Pythagorean expected record based on how they're playing, what their players are doing. And it was much below what their actual record was, which tells me that they were getting lucky in some games, which you'd rather have a win. But although the record was good, the underlying metrics said that this was not going in a good direction. And after 4 days of getting slapped around by the Chicago Cubs, who are now in first place, whose underlying metrics said that they were going to be better than that they were doing, it made me realize something about the numbers we use to follow diabetes. Brian, wipe away your tears. We'd all love to have
I'm
you have
not
a chance.
crying. I've detached from outcomes from sports in Cincinnati a long time ago.
Okay. So what we're going to talk about here is how sometimes, even though the outside air quote record looks good, the underlying system is struggling. Because honestly, we see this all the time in diabetes and metabolic health. So one metric that I think providers hang their hat on, clients, patients, whatever you want to say it, hang their hat on is the hemoglobin A1C, which is a 3-month rolling blood sugar average based on the amount of sugar that has stuck to your red blood cells. Brian, you made a face.
No, I was just gonna say, let me take a guess. But you already
Oh,
named it,
I
so never
already
mind.
said it. We don't have time to guess, Brian. We got to get right to this. So here's the thing. We're not anti A1C, and it can be valuable and it matters, but it's one metric and not the entire scoreboard. Because I can't tell you the number of times in my pharmacy career where someone would come to me and their A1C would not be in the diabetes range. Maybe they're creeping up to pre-diabetes and they were a little cocky. They said, "Hey, Corey, I hear you. You have some stuff for me to do, but my numbers are good. What do I have to worry about?" And Brian, what do you say to that? Because these people 3 months later would come in with an A1C of 13, looking shocked, dismayed, and confused about what happened to their air quote good blood sugar. Their blood sugar went the way of the Cincinnati Reds.
I was gonna say, it sounds like what the Reds probably feel right now is they probably feel shocked and confused and yeah, like a dumpster fire is what
Yeah.
they feel like.
Yeah. So, because here's the deal, the A1C does measure what your actual blood sugar is. But before you see high blood sugar numbers, years before that, you are developing, if you're on the road to diabetes, developing insulin resistance. Brian, we're at a place where there's a toxic amount of energy coming into the body. So the pancreas is having to secrete more and more insulin to keep your blood sugar at a normal level. Maybe
Mhm.
as you get older, or if you're at a job or you're sedentary, you're losing muscle mass. So that capacity for your body to hold on to sugar and store it appropriately as glycogen is diminishing. And so your body is essentially ramping up and working overtime, getting into this place of hyperinsulinemia, where eventually you're getting to a place of insulin resistance. And you might be developing liver fat before you see it. And there's a number of metrics we're going to go through that maybe looking under the hood tell you that the A1C isn't giving you the full kind of picture of danger you're in.
Yeah, I'd love to hear it because you got my attention. And this sounds like a lot like the analogy we use where you're looking at storage tanks. So the storage tanks are essentially filling up at this time, but they're not overflowing yet. But you can start to see the precursors to what's going to happen, right?
Yeah, the storage tank analogy doesn't work perfectly with what we're talking about,
Okay.
but it's like
Well, then never
it's
mind.
like a machine is working overtime to keep them filled up. And so,
Okay.
what do you need to be looking at? So, one of the sort of tricks that I would use looking at possible signs of going down the road of diabetes is some of your cholesterol markers. So what I look at are high triglycerides and low HDL. Now the triglycerides aren't always high in certain populations like African Americans. We might not see as much of a bump of triglycerides. But if you get your cholesterol panel back and your doctor says your LDL is great, but your triglycerides are high and your HDL is low, that's a couple of signs that you're on the path to metabolic problems.
Okay. Good to know.
Okay.
I don't know. I was going to say, I'm just going to let you go because you're,
Okay.
you're running
So
the show here.
all right. So another lab that is not often ordered but is useful is fasting insulin. So if you have a high fasting insulin, that is a sign that your body is sending out lots and lots of insulin to keep the same blood sugar numbers. So you're getting close to a sort of cliff where you're going to fall off.
Yeah.
All
Yeah.
right. The other non-lab markers we want to look at are increasing waist size. If your waist size is increasing, this is a sign that your body's run out of places to store fat in a safe place, and it is putting it around your liver and your other visceral organs like your pancreas. So if anyone's ever heard of fatty liver disease, or the nomenclature is changing all the time on what we officially call it, but we're going to call it fat around your liver, which is your body does not want that. But if it's the last place that it wants to store it, because it is a dangerous place to have body fat. So if your waist is expanding, but your sugars are good, this is a sign that this is a yellow to red flag. And then there's a couple of other sort of non-measurement things. Fatigue, poor sleep, energy crashes, especially after you eat. This is a sign that your body is just in overdrive mode for sending out insulin to lower sugar, and it's often overcompensating and making you hypoglycemic. So having the symptoms of blood sugar swings, which can mean bad energy. It can mean feeling sort of hypoglycemic and shaky after eating. And then this is one of the other things. If you're really dependent on caffeine and sugar for energy, it just means that your body is not appropriately using energy, and you need to be on the lookout for the eventual Cincinnati Reds sweep of blood sugar, where you see an A1C jump and blood sugar drop. So really what's happening here is that some people are, air quote, winning ugly metabolically. They're winning the one-run games. They're coming from behind. They're finding ways to win games, which the standings matter. Your blood sugar matters. It's just not sustainable. Like a team with no bullpen or offense. And if you don't like baseball, maybe you're learning a couple of things here. But if you have underlying issues within that team, eventually it's gonna catch up to you, and the body will eventually run out of the ability to compensate.
Yeah, as a team with no ability to hit with any runners in scoring position. Corey, so you mentioned people might be like at this either pre-diabetes, maybe right below that. So how does it go from just that lower A1C to all of a sudden now they're over 10?
You essentially, I think what this is a speculative mechanistic way of looking at it, but essentially I think your body just runs out of place to store that extra energy despite the extra insulin coming out. To use your storage tank analogy,
it does work.
Yeah, it does work. It comes back to
it does work.
You can push, it's overstuffing a suitcase. You can stuff clothes into a suitcase until there's literally zero room for clothes in that suitcase, and then it's falling out of this suitcase. And so you can mask the problems, but if you don't fix the underlying issue, eventually things are overspilling, whether it's your sugar into your blood or the clothes out of a suitcase.
So is it time to discuss how do we fix this underlying issue, or is there more to really?
I just want to like really emphasize this could be years. Your body can literally compensate for years. It's super adaptive. Your pancreas can pump out a ton of insulin. You can have your hormones compensating, your stress hormones. You can try to mask your fatigue with caffeine. If you're snacking all the time to prevent your sugar crashes, like you're putting Band-Aids on this gaping wound. But even though your blood sugar is looking normal, the body compensates basically until it can't. Like your disease, it whispers before it screams. And so essentially, like you go to the doctor and the doctor has 7 minutes with you and they look at the general labs. Usually that fasting insulin isn't part of it. They'll say, oh, your A1C is good. You're functioning in your life. Your LDL is good. And your triglycerides are a little high and your HDL is a little low. Maybe get out and move a little bit more. But if you're seeing high ratios of triglycerides to HDL, that could be a sign that there's underlying issues. And you're exhausted, you're inflamed, you're maybe not moving as much as you want to. And underneath it all, you're probably under-muscled and you're overfed but undernourished. You're getting all this energy coming in, but not the nutrition that your body needs. The protein, the fiber, the vitamins, the minerals, I'll even say healthy fats here, fiber, all the things your body needs to function well. You're getting calories, you're getting energy, you're getting carbs and fats and snacks and drinks and sugary stuff, but your body's not getting the nourishment it needs. And so it just gives out.
So yeah, that just all of a sudden gives out and you see these higher numbers, and then your doctor, your primary team is, oh no, we need to treat this. This is type 2 diabetes.
Came out of nowhere. What happened? When this could have been a 10-year issue under the hood that you could have turned it around earlier. And the earlier that we can do this, the more effective we can be at intervening. It's not to say that if you've had issues for 10 years, you can't do anything. Of course not. But if you're driving a car, you don't wait till your engine's on fire to check under the hood. You got to be doing this. You got to be doing this maintenance regularly. So we got to catch our trends early, see what our energy is, see what our muscles, our strength is like, how's our sleep, and we got to improve our metabolic flexibility before diabetes progresses. So, Brian, let us talk about how we fix this.
It sounds like we've discussed this many times, but we can definitely reiterate it or rehash it for people who are, maybe this is their first episode they've heard. Steady strengthening. Right. Let's get to that. Number one. The second one is nourishing your needs. So getting more protein and fiber so we can crowd out all the extra energy that is coming in. And yeah, the strengthening will help get to the root of insulin resistance because it starts in your muscle.
So when you say steady strengthening, you'll go to your doctor, you'll see some prediabetes numbers. Maybe you're at that, oh my gosh, we're hair's on fire problem issue. And they'll say, you need to exercise more. And what do I do? Start moving, maybe walk more, which we're never against walking. But when we talk about our body's capacity to handle energy, building muscle, and Brian, we've talked about this in our live webinars. I recently was at a health fair here in Tucson, Arizona, talking to people about what we do. And one of the biggest surprises I hear is I've never heard someone talk about muscle before. I can't tell you the number of people who came to me in that, like, I'm in middle age now too, but middle age, I don't know what happened. Everyone in my friend group, we all have the same labs. We all go to Zumba together. We're religiously moving our bodies. And I said, that is great. But what's probably happening is you're under muscled. You're moving your body, but there's not as much muscle moving when you're doing it. So you're not sucking as much glucose out of your body. And so I think that's what maybe our perspective sets us apart from a lot of other pharmacists or even doctors or people in the diabetes world is we can get at this prediabetes problem. It's like making a trade in the off season to get a better team. Maybe you won 85 games last year and stuck into the playoffs like the Reds did, but it wasn't because they were great. It's because everyone else was bad. And so you need to make your team better. Sorry, I had to make another dig.
Lots of jabs at the Reds, man. Oh man, I love it.
Don't worry. Next week, by the time this releases, the Cubs could have lost 6 in a row. So it's
highly unlikely.
What
does your Pythagorean rhythm say?
Pythagoras says my crystal ball is cloudy, but it's not cloudy about what you can do to stop this process that's going on under the hood in the body, building that muscle, nourishing needs. This essentially just means when you're eating food, you have nutritional food and energy food. Nutritional food being protein, fiber, vitamins, minerals. Energy food being carbs and fats. That's right. We are not team low carb. We are not team low fat. We are team kind of low carb and kind of low fat. Less overall, right?
Yeah.
And so this means more protein-centric foods, lots of vegetables and some fruits to get your fiber. And this will crowd out a lot of the excess energy coming into the body. So when you create a better capacity to store it by strengthening your body, you put less toxic energy in, and yes, keep moving your body so you're utilizing that energy, you're going to be able to get at the root of this. And I can't tell you the number of people. I specifically remember someone that when I was in clinical practice, came to me, a woman in her early 70s, A1C of 13. And she's, what is going on? I ride a bike for an hour a day. I swim for an hour a day. And we looked under the hood, metaphorically. And she was actually a huge baseball fan. We talked a lot about going to different stadiums. So we're going to make this all work together, Ryan. But she wasn't doing any, and you can kind of look at people's bodies and notice they just don't have muscle.
Yeah.
So I said, you got to start strengthening your body. And we talked through what their eating habits were. And they said, I'm eating healthy. Every morning I have fresh squeezed juice, whole wheat toast, oatmeal. And in isolation, juice is pretty sugary, but oatmeal is not, you're not here because you're eating too much oatmeal. And a whole wheat toast isn't I don't think it's the health food it's made out to be, but it's not the devil it's made out to be on the low carb world. But there's no protein in there. You're getting all your fiber is from grains, which is a higher energy source of fiber. So we talked about stop mainlining juice in the morning, sugar basically. Juice is when you're hypoglycemic and your sugar's crashing. Otherwise, there's no medical necessity for juice. So we fixed a few of the things with the diet, got her moving, got her building some muscle. And her A1C, she did go on metformin. She refused insulin. I helped her avoid insulin, but she did go on metformin to appease her doctor. And her A1C went from 13 to 6.5% in 3 months. And I can tell you metformin in isolation doesn't do that. And the cool thing was the energy coming back, the fatigue, the brain fog, like so many of these other underlying issues that happen that you can see under the hood that you're masking with caffeine and sugar and snacks. When you improve your body's ability to utilize energy and not be in an energy toxic state, you feel better subjectively.
Yeah. Yeah. That sounds like an amazing story. And I'm really happy that you were able to help her avoid insulin and just drastically just change her metabolic health.
Yeah.
And write like a different story. She's just living a different life now than I'm sure she would have been.
So yeah, and it doesn't mean if your A1C is good and it was higher and you lowered it, don't be like, freak out. We don't want you to do that. Enjoy the wins. Brian enjoyed every Reds win on the road until this week when it was just
there it is.
Snuffed out, right? But good teams pay attention to the underlying numbers before the losing streak starts. And health works the same way. So we don't need to obsess over perfection. We don't need to panic over a single number. We got to think systematically, look at trends, and build health before there's crises. And on your road to remission, there's also going to be times where your labs and numbers are lying to you. Like we have so many clients where their weight isn't budging, but their body composition is improving, the waist circumference is improving, but everyone cares about the number on the scale. Maybe their post-meal sugar is improving, but their fasting numbers aren't budging yet. But that's why we coach you through it. We've seen this hundreds of times, thousands of times. The underlying numbers say that you're on the path to remission and success, but in isolation, you're freaking out because all you know is your doctor just says A1C, fasting numbers, what's the scale? And so when your friends start seeing more definition in your body with muscle, when you start feeling more energy, when the heartburn gets better, when your pants fit looser, even though the scale isn't budging, you're building muscle and redistributing your body weight away from your dangerous visceral fat to muscle. It's going to get there. And for some, it'll take months. For some, it will take less time. But that's why we look at those underlying numbers.
Yeah, for sure. That's definitely a good point. I like the whole analogy you brought here. I think it really clears up the whole picture. Even though, yeah, I'm just gonna thank the Reds for taking the brunt of the criticism and that I usually get. Not criticism, but the jokes that I usually get. And I also want to acknowledge I heard felt you used the phrase crowd out, and I just want to acknowledge you for that because it sounds like it's starting to stick. We're maybe getting to the point of you're adopting some of these more health coachy phrases here. So good job, Corey.
Thank you, Brian, for acknowledging that. And so when you're looking at your blood sugar, remember, a good scoreboard is great, but real health is about building a system strong enough to keep winning long term. So we want to hear from you. Share some of your wins. Send us an email, find us on Instagram, send us a DM. And if you're listening to this and know someone who's struggling, who's in that prediabetes range, who's saying they're fatigued, send this episode to them. Text it to them right now. Put it in a group chat. Because we see people all around moving throughout this world that the underlying metrics say that they're due for a losing streak with their health. And we want to help. So,
yeah.
And if you like baseball, let us know too. Who's your favorite team? Let us know. Send us an email. If you're a fellow Reds fan, I'm sorry for beating your team up on this one. And if you are a Cardinals fan, you can just ignore us. I'm kidding.
No, I'm actually glad because it produced this great episode. Now I'm grateful for the Reds go on this losing streak here. It just produced such a great idea for this episode. So thank you.
Boy, you're going to love the episode after the Cubs win the World Series. It's going to be the best diabetes metaphor ever. So we appreciate everyone listening. We read all the comments. We read all the emails. We love hearing the stories. Share the wins. Share the scoreboard wins. We do want to acknowledge sharing little wins, but we know how to read the scorebook. We know how to look at the analytics of blood sugar, and we can look under the hood and understand what's going on. So we hope this episode resonated with you. Share it with someone who did, if it did. And until then, this whole episode is about what we say at the end. Keep it simple and do what works.